I'm Jessica. I'm the program director at the Clinical Innovation Center at UCSF. We build the internal infrastructure capacity to innovate within the care delivery setting. So I was invited to speak at the panel today to talk about how designers could more work with frontline staff to innovate within the care delivery setting. So thinking about design and healthcare delivery system, that's what I do every day. And so every day I go into the unit and I think about how do we make the service line better? How do we make the workflow better? And a lot of times thinking it from the designer's perspective, it's really useful. And so we work with clinicians and nurses on the front line and we ask them like, why are you not doing this? Like, what are some of the barriers that are inhibiting you to doing something new? And so it takes a lot of design thinking into providing them a strategy and framework to do something better, to motivate them. And that's basically what I do every day. If you're asking a nurse that have been there for 20 years, then can you use an iPhone now? Like, can you use this app? Like, they don't even know a lot of times how to use it, let alone to teach the patients how to use a new technology. And so those are simple barriers, but it's significant because a lot of our workforce are very diverse. So from nurses who have been there for many years to new nurses coming on, same with clinicians, so a variety of people that we're working with. So what does it mean from talking about from volume to value? It means a lot in the hospital because we look at volumes a lot. So how many times did we do the procedure? But now we're saying if the patient comes in again, it's actually not value to us because we actually get dinged for having patients be readmitted. So in that case, how do we create the best care when they are here? So that's trying to figure out how could we provide cost-effective care? How do I provide the best care at the onset and so they don't come back again? I hope that people take away from this conference that there's a lot of hard work when you talk about design and medicine. It's not just really seamlessly that it's going to work very nicely. Our designers work with us daily. They go into the front line. They work with them. There are a lot of barriers that are introduced, but it's like a family. And so like when you introduce a new member into the family, you really need to work things out. And so by working together slowly and slowly, you really create this culture of innovation within a setting. And so it's basically like family. And so you just have to work hard together, build the trust in order to make it work.